All right, welcome back and thank you for keeping it Body Garage here on TV 47, where on this episode we are focusing on dental checkups and dental cleaning. With me is Dr. Branice Munyasa. So Daktari, before the break, we was talking about children and why it is important. Maybe you could finish up on that point and also highlight why pregnant ladies, are they also in this category that need to regularly visit?
Okay, so let's finish up on the children. So I'd introduce the aspect of creating a dental home for your child, even though before the teeth come in, they're not really getting anything done except familiarizing themselves with the dental office. And then, of course, once the baby teeth start to come in, the whole point of coming to the dentist is first, we want to keep the baby teeth in the mouth until the permanent teeth are ready to come in, because what we say is that the baby teeth are the best space maintainers for permanent teeth. If we have early tooth loss, it means that we might lose the permanent tooth space, which can create problems like crowding in the future. Okay, we also want to keep the child free of dental pain. Okay, you know how children can be fussy when they're not able to eat, when they are in pain, for example. And some of the ways you can look out, if the child suddenly is not chewing it one side, then you start wondering, do they have a cavity or not? So first we keep the child pain-free, infection-free, and make sure the baby teeth are there until the permanent teeth are ready to come in the mouth. So you'll find people asking, why should I need to bring my child to the dentist and those teeth are going to come out? Okay, the child has a cavity, why do I need to do a filling? And this is a baby teeth, the permanent teeth are going to come out. I mean, by the time the child is fully in permanent dentition, we are talking about an 11, 12-year-old. So for example, if your 5-year-old has a cavity, are you going to keep the child with pain and risk of infection for 6 years just because the baby teeth is going to come out? See, so that's the reason why we still do fillings and all that, because you want your child to be comfortable, pain-free, able to eat without being having a fuss. And we want to maintain that baby tooth until the permanent tooth is ready to come in the mouth.
And for the baby teeth, when do they start coming out?
Shaking, or when do they start
shaking and then come out.
So usually we give a range of 5 to 6 years. So anytime from 5 all the way to 6, that's where you start seeing them shake. Okay. So this means that if you have an 8-year-old, 7-year-old, and their teeth are not shaking, then you definitely need to follow up and find out why they are not shaking.
Let's get to the question of the expectant ladies. Are they exempted from a dentist checkup and visit? I've had that around. I don't know if it's true.
Okay. So now you say the different types of pregnancies. There's people who really plan this and then like, oh, oops, I'm pregnant. Okay. So for example, so if we talk about the guys who are planning, one of the things that you're putting before you start is dental visit. Okay, you want to get your teeth checked, have them clean, make sure you don't have cavities, because for some reason, because of the hormonal changes, our pain threshold tends to be quite low. Okay, so anything that would cause you discomfort, like you might perceive it more. Okay, and then because of also the hormonal changes, our gums tend to be more inflamed, more easily inflamed like the other people. So any little buildup will otherwise cause you more inflammation than if you were not pregnant. Okay. But let's say, okay, you've already found out you're pregnant and you have dental pain. It doesn't mean you can't go to the dentist. Okay. What we try to do is just to make, especially when you are a bit far along, is to make sure that you don't stay on your back for too long because of the pressure of the baby on what you say, the aorta at the back. So we also don't want to do a lot of x-ray exposure as well. Okay, I mean, you can totally, for example, like you see a procedure like root canal that needs us to do root canals at every x-rays at every step of the procedure, becomes something we probably need to postpone if we can manage the pain, or we just do the first step and then we complete, or we compromise and do the procedure without the multiple x-rays. So you see there's a lot of that. So if you can have your dental checkup before you start trying, it will be much better. But it doesn't mean you still can't go to the dentist. It just means that we will minimize the x-ray exposure to you and maybe make your dental visit very short.
Okay, so I'd love for us to get now to the practical bit so that we can see what to expect when I come for a checkup. So if you could take us through that with our very handsome Dylan here.
Okay, hi Dylan. So we're just going to do the oral exam. Okay, so basically when you walk into the dental office, like we said, I'm going to do a physical exam to give me a general outlook of how your teeth are. Okay, and you can see it needs very close contact with the patient, and naturally when we are talking, there's always some micro droplets that might come when I'm talking. And as you remember, in the age of COVID, we were wearing masks because of that droplets. Okay, so because already at the dental office you already have very close contact, and the dentists themselves see quite a number of people during the day, so you don't know what you'll pick from someone and give it to another person. So this is the reason why we put on mask. Unlike general population where you think that you're putting a mask because our patient's mouth is stinking, that's not the reason why we put mask. We put mask as part of cross-infection control. Okay. So this means that we are reducing the chances of me picking something from one patient and spreading it to the other patient. This can be from me to the patient and come from the patient to me, because you'll see as we continue that the aspect of dental cleaning involves a lot of water spilling around, so, and saliva also from the patient's mouth. So this can come from the patient and come to me. Okay, so this is why, like, I'm putting on my headscarf also, because I don't want to pick stuff from my hair and take it home. Okay, yes, and I also don't want to inhale, and I also don't want to. So it's really about infection control. Okay, so the first part of the checkup is obviously the patient will tell me why they came to the dental office. So if they have any obvious issues like pain, this is the part where they have told me before we sit down. And then if it's just a general checkup, then of course I just check if there's anything we need to be concerned about. Okay. Yeah, so obviously I need to put on my gloves.
And for us who fear the dentist, should we be afraid that there's pain associated with this whole checkup?
No. At this point, we are doing very non-invasive procedure. It's just me taking a look.
Okay.
Yeah.
But you know, the machines are really intimidating.
Yes, that's true. The machines are quite intimidating. But this is just to help the dentist see better. Like you see, this is the light. And people are like, oh my God, what's that? Yes. But it's just a light to help me see the patient's mouth better. I'm going to move this set a little bit up, just a little, to make it easy for me to see. And then Dylan, you're going to move back. Okay, and then open. Okay. So like I said, we are checking for cavities. Any tooth that has a cavity means I'll see it, or my instrument will be able to go in, because teeth is made of mineral. So any softening means there's something happening there. We are also checking for any build-ups on the teeth and stains. Okay, and then at this point I'll have already noted if there's something I need to be concerned about. Okay, and then at this point we will now do the dental x-ray. And a lot of people will say, why do I need dental x-ray? I'm not in pain. So the reason why we do dental x-rays is because the contacts of our teeth are so tight. Yes. So if there's a cavity in between the teeth, then I'm not going to be able to see. But with the help of the dental x-ray, first I'll be able to see any hidden cavities. Second, if there are cavities, I'll be able to see how deep are those cavities, okay? And then, because the depth of the cavity will determine the treatment choice I give you. For example, why am I doing a filling as opposed to a root canal, or are we doing an extraction, okay? And then we will also be able to assess the position of your wisdom teeth. So for example, if they're not in the mouth, are they growing? Are they not growing? How are they growing? So that you're able to plan better. These are things you'd otherwise not see by just looking
at them.
Okay.
Yeah. Okay, and do you check for the bite as well, and why does it matter?
So that mostly we'd be looking at it if the patient, for example, is concerned the patient, for example, is concerned about aligning their teeth, because at the end of the day you want a stable bite, okay? So for example, like in the case of Dylan, this is an general normal. Normal is where you have the upper teeth biting on the lower teeth slightly ahead, but sometimes you have the lower teeth coming ahead or the upper teeth going too far ahead. Okay, so this is where we talk about an overbite and an overjet, and there is normal, and then there is something that is not normal. Okay, yeah, so most of the time when you're focusing on the bite is really if there's a conversation of are we doing alignment or not. Yeah.
All right. You said that now oftentimes the checkup comes hand in hand with the cleaning. So let's get to the first step of cleaning. What does it look like?
So, so first of all, like I said, I wanted to show you why we do the cleaning, because I'll show you on the scan there. This is a different kind of a scan. It's a 3D scan that enables us to do patient education, and it's also very helpful when we are doing alignment. So you should be able to see, yes.
It goes into the mouth.
Yes, it goes into the mouth. So the tips are changed and sterilized for every patient. And then you can see from there, I'm able to show my patient or client why we are doing cleaning, because you see, the moment the person knows why you're doing something for them, then they are able to understand the process, and they are able to understand why they need to come back, and they're also able to appreciate the difference once you have completed the treatment, because you're also able to do another scan and show them the after. Okay.
And once again, that scan is painless.
Yes, it's like it's taking, if you can see, it's like taking photos and creating a 3D image. Okay, so I'll not take the scan for the upper teeth, but this is enough for me to show Dylan why we are doing the cleaning for him. So like I said, over time, even as you brush your teeth, you'll always get some micro deposit between the teeth. So you'll see, once we do the cleaning and we take another scan, we will have removed the build-up on the teeth. Okay. So this is the build-up. I was saying that even if you don't have cavities, this build-up is not healthy for your gums. It's not healthy for your gums, so it will cause inflammation, and then at some point, if it stays for too long, your gums start to bleed, to show that I am sick, I need help, take me to the dentist. Yes.
Okay, and that buildup can be seen with the natural eye.
Yes, you can see with the natural eye for the buildup, and then that is just for patient education and to help us build up on the treatment plan.
Yeah. So is this build-up the one that is called plug or tartar?
Yes, that's what we call plaque, tartar, but more long-term is called calculus, because it has, plaque is like you eat something now, tomorrow there's still build-up on your teeth, that's plaque. But the moment it stays for your teeth for longer and starts to solidify, then we call it calculus.
Okay.
Yes.
All right, Daktari. Thank you for taking us through that, and I would want you to hold on as we take the second commercial break. On the third part of this particular episode, we will now get to the dental cleaning bit of it. Do not go too far. Keep it TV 47.